Hi, my name is Mackenzie O'Neill, and this is my PowerPoint for caring for children with allergies. Identifying children with allergies. It is important to get allergy information from families at the beginning of the school year, the symptoms the child has whenever having an allergic reaction, and to remember this information. To the side, you'll see that this is just a generic sign that some classrooms may have either posted outside the classroom, in the classroom, or even sent home throughout the school year. I suggest all three. It shows that this is an allergen-free zone, and it also shows what possible allergens might be in that classroom that we need to avoid. An inclusive education supporting children with allergies in a school setting could look like many different things. It could be for children to have the equal access to learning and social interactions while providing a safe learning environment. This may look like having an individualized plan in place, and that's kind of where you have certain actions that need to be met and taken in regards to the child having an allergy. It could also be an allergy-free classroom, promoting communication with parents and other staff members to inform them on allergies, and most importantly, making the child feel safe and included in their classroom. This could be from something as simple as mealtime, making sure that the child ends up having a separate meal that is different from the other children. And this could also be something like whenever a child is having a birthday party and the family member is bringing in pizza, and say a child is allergic to tomatoes. This is a great example of how to just make sure all children feel included and not left out in any way. Identifying allergic reactions. It is crucial to identify an allergy reaction quickly. This may look like itchy red or swollen skin, hives or itchy welts or a rash, shortness of breath, coughing or wheezing, itchy ears, mouth or eyes, swelling in the lips, eyes, face, mouth, and so on. The child could possibly pass out, tightness or hoarseness in the throat. To the side, you'll see what may be going on and what the common term could be and what to look out for with certain reactions. Supporting teachers with students with allergies. Providing professional development. Trainings for teachers to make them feel more comfortable having students with chronic disease allergies, such as first aid and CPR classes, and to keeping up to date with those trainings, and allergy awareness trainings. Collaborative support, putting together a team of support members such as a nurse, other teachers, and school staff to have a plan in place for children with allergies in case of an emergency. Providing resources and materials, allergy-free snacks on hand, and having access to necessary resources such as emergency allergy medications, especially when going on field trips. This could also look like with having a set person in place in case there is an emergency with allergies, having a set teacher that could step aside and help with your class while you help your student. A teacher's role. A teacher's role is important to make all children feel equal, included, and safe at school regardless of the diversity the child may have. Teachers can do this by education and awareness. Teach all children to be aware of allergens. So this is kind of more age appropriate. It depends on what age you're teaching, but making sure that the children know, hey, this is a nut-free zone, and you could even take it to the point of showing videos to the child, like to kind of get their attention, or if you're teaching an older age group, you could actually explain what an allergy may look like and how serious it may be, without, of course, scaring the children, because you don't want to do that. Individualized health plans. An IHCP that outlines the child's specific needs and emergency procedures. So I'll have a form and I'll attach that later in this that kind of just shows what kind of happens like for their individualized plan. So for example, my son has one in place because he does have allergies and he does have asthma. So on his form, it kind of shows like what to look out for in each stage of an allergen or an asthma attack. So with this, it kind of just gets you more familiarized with what's going on and those signs that the child may have. Safe snack options. Keeping only allergy-free snacks in the classroom and taking extra on field trips. I think this one is one of those very important ones because you don't want to say give the whole class one snack and then give the child a different snack that has an allergy, because a lot of times you're going to see that child kind of looking at the other children with a little bit of jealousy because they want to be included. They want to feel like everybody else, especially at such a young age. They don't necessarily understand why theirs may be different. So I think that that is very important. And also taking extra snacks on field trips, because usually on field trips you see where the school is providing a sack lunch, and with having to provide so many sack lunches, sometimes they could get a little mixed up and still provide a sack lunch that the child could be allergic to. So with bringing extra snacks that are allergy free, this ensures that the child will have something to eat just in case there is a mishap. Allergy-free zone. Keeping the classroom an allergy-free zone, informing families and teachers of allergens that are not allowed in the classroom, and having posted signs of allergy-free zone. Again, that goes back to the picture that I showed you earlier in the slideshow. Kind of just saying what allergies are in the classroom is a great way to have people informed, and just like that gentle reminder every day that is visualized there for everybody to see. Inclusive activities. This could be anything from, like I said, from birthday parties to just plain lunchtime, mealtime, to different things. It could be holidays, like going out and getting candies, like you don't want any, for example, nuts. Nuts are huge, especially during Halloween, because they're in a lot of chocolate candies. So making sure that people are aware that there is that allergy and just eliminate the allergy completely. And emergency preparedness. That cannot be stressed enough, because that is the most important thing as a teacher's role, is to be prepared in case of an emergency. It is our job to keep children safe and feel included, but also just to make sure that if something were to happen, that we have them. We're going to take care of them and make sure that they are safe. Have an emergency plan in place. Children with severe allergies usually have a prescribed allergy medication or an EpiPen. Teachers should know how to identify that their student is in distress and call for the appropriate actions to be made. Students with severe allergies have a health plan that is provided by their primary care physician for the appropriate steps to take. A copy of this should be in the nurse's office as well as the teacher's classroom. So as you can see on the side, I do have a plan that is set to over there, and it's blank, but you could kind of get familiarized with what the severe symptoms may be, what the mild symptoms may be, and kind of just what actions to take. And then underneath it tells you like when to call 911, when to administer the EpiPen, when to give the allergy medication. And then down below you'll see the EpiPen, which comes with 2 EpiPens that are given, I believe it's 15 minutes apart, depending on how bad the allergen is. And then also there's going to be a trial EpiPen